I have two career interests to be at this forum. One as a genetic counselor, where I meet patients, families, and help them with their genetic diagnosis, understanding the rare disorders, going about meeting different clinicians, specialities, and connecting them to different networks. And as a genomic scientist, my lab works towards developing diagnostics, cost-effective diagnostics for rare disorders. We use technologies like methylation specific PCRs, long read sequencing, and also we develop different bioinformatics pipeline and solutions for different rare disorders, for genetic disorders. There are more than 8,000 rare genetic disorders. If we go to count on that, there is almost 11,000. As we say, it's a rare disorder, also the information about it is very rare. We would assume that the clinical fraternity would have information about all of them, but that is not the case. They are also evolving as in when they are seeing a patient with rare disorder. So, like I said, the journey could be very unique. Yeah, the steps are somewhat similar for all disorders, but for each individual and each family, it is unique. So, sometimes the parents might feel that they are alone in this journey. It's important, and it is also very much personal for everyone how they take a condition. Somebody would want to understand so that they can take the best care for their child. For that, they might need the diagnosis. For somebody, it would be like, maybe this child is affected, I am not able to do much about it, the system is not able to help me with that. But if suppose I plan a next pregnancy, I would want a healthy child. Or it could be for the reasons that maybe I have a child who is affected where I'm not able to support, the family is not able to support. But what if I was equipped with this information early enough? What if I could help my other siblings who are still in the reproductive age, where they can do the planning accordingly and they could have a child? So sometimes, though the journey could be unique, it could be alone, but there are certain steps they would have to take alone so that they can eventually get integrated with the system. The system is out there in bits and pieces, because with the patient, even the clinical fraternity is learning to care for rare. We feel that the journey only starts with the diagnosis, but that is not the case. From the time the child is born, sometimes for a rare disorder, the child doesn't live up to other children of that age. Maybe at 3 months, at 6 months, what the other children are able to do, like the head holding, or ability to turn when they are put on the bed, or ability to suck milk properly. Even from there, the mother is under doubt, why is my child a little slow? Maybe she would have had a child elder than the kid who was able to reach all milestones. So she starts this mental comparison much before even she gets to know that there is something wrong with the child. So then there are so many consultations that happen. It's not in a single go that a person understands that they have a child with rare disorder. Even in developed countries like UK, US, it would take around 5 to 7 years to reach the diagnosis. So we can only understand. When we know what it is, to manage it, it becomes so difficult. When it is unknown and untreated, we can only imagine the plight of the mother that she has to go through. So that is why by the time she reached the diagnosis, oh, this is what was wrong, she has already put in all her efforts, she has struggled mentally and sometimes doing all of that alone, that she gets exhausted by the time she reaches the diagnosis. We do need to have the system wherein it's an integrated care, where there are newborn screening is one such platform, where early children, in the early way, when if the child is showing certain symptoms, certain syndromic features, they can get referred for a genetic testing. That is one platform. More sensitization amongst the clinical fraternity. If they see certain clinical features in a child, when they come for vaccination, when they come for early consultation, it could think that it could be of a genetic condition. With such measures, we could integrate so that a genetic testing and genetic care starts from very early on, so that the mothers do not have to do the guesswork. They don't have to do Google where do I go, where is the specialist. They don't have to travel different countries, different states just to reach the diagnosis. So in that way, the system could be of help. And also, there are so many different genetic tests. If only that was made available, if all the information was out there, if the access to a genetic counselor gets easier, then it becomes much more simpler and easier for the mother to take the decisions for themselves. Very interesting fact about this forum, it humanizes the mothers. It does not call them as superhuman, as godly figures. That is because only when you think of them as humans you would be able to sympathize, you will be able to empathize with them and not sympathize. When you sympathize, you only pity for them from a distance. You are not able to walk in their shoes. But when you are empathizing, that means you are able to put yourself in their position. You're able to take look at the situation from their perspective, and you try to understand what does she has to go through every day. So this perspective shift this particular platform is able to give. So that is something that I really liked about this forum.